of you know because of her more recent visit to Denver, Bishop Catherine Mutua. Bishop Catherine is the first woman to be elected a bishop in Kenya and has given outstanding service during the 8 years that she has served. We have a special affection for you, Bishop Catherine, and welcome you now to share with us.
Hi, everyone. Thank you so much, Don, and the team, for this wonderful opportunity that you've given us again to be able to see everyone and even have a moment to thank you for the wonderful work that you've done. We are so grateful. I join my brother, Dr. Sam, and agree with what he has done and experienced in India. And most of what he has talked about is similar to what we are doing here, and is similar to what we go through. Our challenges are kind of similar. And therefore, I want to appreciate you so much for the wonderful work that we have continued to do, Center for Health and Hope and Kaga Synod. I told my staff that I'll be seeing you today and we'll be talking. And so they sent a lot of their appreciations to each one of you. We are so, so grateful that you are able to intervene very, very quickly. Actually, we had not thought about you coming in such a very quick intervention, which you did. And therefore, I wish to appreciate you and leave the agreement. The thing is, I want to appreciate the long-term relationship that has existed between Kaga Synod and Center for Health and Hope. We have done a lot of interventions together to the people who are suffering from HIV and AIDS, and particularly the orphans and the healthcare workers. So Kaga Synod is a very big organization, and therefore for us to be able to reach out to all the corners of this synod, we decided to divide the synod into clusters, and therefore we had 8 clusters, and every cluster had pastors that are senior pastors in those areas, and every cluster has community health workers. So what we did, because of the social distancing, we were able to bring people to the nearest cluster, and that's how we have been trying to reach out to them, especially the time that you are distributing the food. So it has been very effective because we were able to feed them and we were able to maintain the social distancing. And we thank God because the same time the Center for Health and Hope intervened and sent us some money, $4,000, we also received a similar kind of money from another organization in Texas. And we were able to combine the two monies, and we fed all the children in our program. Currently, we are having HIV and AIDS orphans, 663 in Kaga Synod. So we combined the effort and we were able to feed all of them. We gave them some food that was able to last them for at least 2 weeks, for those of them who had 3 members of the family and below. And for those, those who had 3 members of the family and below could take them for at least 3 weeks. But those who had larger families, the food lasted for 2 weeks or less. But all the children in the program were able to feed, and we have no words to express their gratitude. We have no words to say how much they appreciate and the caregivers, because right now things are becoming very ugly in Kenya. Today we actually registered the highest number of cases in this country than we have had in the last 2 or so months. And therefore people are getting hopeless because even the caregivers who have been feeding these children when they're at home, right now they are not doing any wages, they are not getting any source of income at all, because people are not welcoming them into their homes. And the kind of jobs they were doing, the casual workers, they are not doing them anymore. And the other thing is some of them actually have been relying on the well-wishers, and mostly in schools, they have been being fed at school. So this time when everybody is afraid of what is going on, the orphans are out there frustrated and their caregivers are actually getting it. So we distribute them the food, some rice, gave them some beans and and of that they have been able to stay at home. Therefore, we thank you and we appreciate what you have been able to do so far. And we are trusting upon God that the call will continue, because we don't see ourselves coming out of this situation anytime soon, considering the way things are right now. So it is a very sad and pathetic situation for us. And actually, everyone is feeling the itch, everyone is feeling the pain and uncertainty. So I to specifically thank you for what you did and appreciate you so much. And thank you, because we had not thought you could come in the way you did. So God bless you. I want to appreciate Donna that gave his or her money, and more specifically, the people that are watching us tonight, for Kenya is tonight, and God bless you so much. So we appreciate you so much and we love you. Thank you and God bless you.
Thank you, Bishop Catherine. And I'm sure people have questions for both Bishop Catherine and Sam, and you need to send those by chat so we begin to get those. I know it's hard to listen and write questions at the same time, but just keep that in mind as a function. At this point, I'm